Hey everyone, so today we're going to dive into a bit of a medical mystery, one that I actually see in the clinic all the time. It's a story that almost always starts without a single warning sign, right up until a completely life-altering moment. In this explainer, we're walking through the medical story of osteoporosis. We often call it the silent bone thief. We'll cover exactly what it is, how we as doctors diagnose it, and most importantly, how we can fight back. Picture this. A patient comes into the ER in excruciating pain. Now, they didn't fall off a roof, they weren't in a car accident, nothing like that. They literally just tripped on a living room rug. Or maybe they bent over to pick up the morning paper. Or honestly, maybe they just coughed. But that minor, everyday stress, it resulted in a shattered hip or a severely broken back. This is osteoporosis in action. It secretly weakens your bones over years and years. But you've got to wonder, how exactly does a bone just snap from a simple cough? Let's get into section 1, inside the bone bank. To understand why a bone simply snaps without any warning, we've got to look under the microscope and see what's happening biologically inside the bone itself. Okay, so healthy bone is actually a living, breathing tissue. Under a microscope, it looks like a tight, dense honeycomb matrix that's constantly breaking down old cells and building new ones. But osteoporosis, it totally disrupts that delicate balance. Your body starts breaking down old bone way faster than it replaces it. So that tight honeycomb degrades into this incredibly fragile, porous structure full of massive holes. The internal scaffolding of the bone is quite literally washing away. So why does this even happen? A great way I like to explain this to my patients is to picture your bones like a bank account. When you're young, your body is rapidly making deposits, right? You're building up bone mass. And by age 30, you generally hit your absolute peak bone mass, literally the most bone in the bank you're ever going to have. After age 35, well, the body naturally starts withdrawing a little more than it deposits. If you didn't build up enough savings early on, or if those withdrawals suddenly speed up, you're heading straight toward biological bankruptcy. So what triggers those massive withdrawals? That brings us to section 2, causes and hidden symptoms. Let's figure out why some people maintain strong bones while others end up with that fragile, hollowed-out structure. It really starts with risk factors we simply can't control. Getting older is a universal risk for all of us, but biological sex plays a massive role here. Women are much more likely to develop osteoporosis, especially right after menopause when those bone-protecting estrogen levels just absolutely plummet. We also have to look at genetics. Being of Caucasian or Asian descent, having a family history of hip fractures, or honestly even just having a naturally small body frame means you basically had less bone in the bank to start with. But there are also lifestyle risks that aggressively drain our bone bank, and these are things we actually can control. A sedentary lifestyle basically tells your body, hey, we don't need to maintain strong bones. Smoking and heavy alcohol use actively interfere with your natural bone formation, and a diet that's severely lacking in calcium or vitamin D, that just starves your bones of their essential building blocks. Now, with all this biological breakdown happening, you'd think your body would sound an alarm, right? Well, not exactly. We call this a silent disease for a reason. You usually don't feel your bones getting weaker. But there are some hidden red flags. You might spot a patient who is literally shrunk an inch or more in height, or they've developed a stooped, hunched posture. Or maybe they just have nagging, unexplained lower back pain. What's actually happening there is the vertebrae and the spine are becoming so weak that they're crumpling under the body's own weight. We call those compression fractures. Moving to section 3, the investigation and diagnosis. As a doctor, knowing these risks and these hidden symptoms, how do we actually catch this before a devastating hip fracture happens? That is exactly where the DEXA scan comes in. If you're over 65 or a younger postmenopausal woman with some of those risk factors we talked about, we are absolutely going to order this. It's a quick, totally painless x-ray test that takes maybe 10 to 20 minutes. You literally just lie on a table while it uses very low-level x-rays to measure exactly how much calcium and mineral is packed in your bones. Usually we're checking the hip and the spine. Now that scan gives us a score. Sometimes it reveals a condition called osteopenia. I want you to think of osteopenia as the yellow traffic light. It's a massive red flag. Actually, scratch that. It's a yellow flag indicating your bone density has dropped below average, but you haven't quite hit the severe osteoporosis stage yet. It's a crucial window where we can step in and prevent further damage. But what happens when that light turns red? So the DEXA scan calculates what we call a T-score, which compares your bone density to a healthy young adult. The absolutely crucial number here is minus 2.5. If your T-score is minus 2.5 or lower, the diagnosis is officially osteoporosis. Your bone loss has crossed the line and your fracture risk is now dangerously high. So once we know that, what is our game plan? Section 4, defending against fractures. Getting this diagnosis can feel incredibly scary for a patient. I see it all the time. But this is exactly where we transition from the danger zone into a really empowering, actionable defense plan. We attack this with a super simple, evidence-based 3-step strategy. Step 1 is physical, stressing the bones with weight-bearing exercises to actually trigger new bone growth. Step 2 is nutritional, fueling up on the exact minerals the bone needs to rebuild. And step 3 is environmental, aggressively fall-proofing your home so you don't take the tumble that causes the break in the first place. Let's look at the fuel. You've got to hit your calcium goals, usually around 1,000 to 1,200 milligrams a day. You can get that from low-fat dairy, dark leafy greens like spinach and kale, or even canned salmon with the bones. But here is the biological catch. Your body cannot absorb that calcium without vitamin D. It's like having a lock without a key. You have to combine your calcium intake with safe sunlight exposure or vitamin B supplements. Without it, all that calcium just goes to waste. So how do we tackle the physical environment? That brings us to fall prevention. And I absolutely love this quote from Dr. Matthew Drake over at the Mayo Clinic. If it looks like a bad idea, it probably is a bad idea. Like, do you really need to climb a wobbly ladder to clean the gutters? Probably not. Keep your rooms brightly lit. Get rid of those slippery throw rugs and install grab bars in the shower. Avoiding unnecessary risks is your absolute best physical defense. But what if all this isn't quite enough? Section 5, medications and next steps. What happens when a patient is doing everything right? The diet, the exercise, the fall prevention, but it just isn't quite enough to stop the biological bone loss? Well, that's where medicine steps in. We actually have an incredible variety of medical tools to help here. Our first line of defense is usually a class of drugs called bisphosphonates, typically taken as oral pills to slow down bone breakdown. Then we have biologics, which are given as injections maybe a couple of times a year to actively block the cells that destroy bone. And finally, hormone therapy, which can help replace the protective hormones lost during menopause. Honestly, these medications are absolute game changers for reducing your fracture risk. But there is a massive, strictly enforced rule I give my patients if they are prescribed those daily or weekly bisphosphonate pills. You absolutely must stay perfectly upright. No lying down, no bending over for 30 to 60 minutes after taking them with a full glass of water. If that medicine washes back up, it can cause severe, incredibly painful ulcers in your esophagus. It's a strict rule for sure, but it keeps you safe while the medicine does its vital job. So, knowing all this about the silent bone thief, it's time to do a quick audit of your own bone bank. Think about your family history, your age, your lifestyle. If you're over 50 or you have any of those risk factors we talked about, it might be time to step into your doctor's office, ask for a DEXA scan, and find out exactly what's happening inside your own bones. Catching it early can quite literally keep you on your feet for the rest of your life. Thanks for joining me for this explainer, and I'll see you next time.